now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
Well, folks, we're continuing our journey here with healthcare. Lehigh Valley Health Network just keeps on getting better and better. We like to bring some information to you pertaining to the new people that are coming on board. Not new to medicine, but new to our area. Today, I'm very happy to present on the show Robin Bohanan. Robin Bohanan is a certified nurse practitioner, right? Is that correct?
That's correct.
Well, Robin, thanks for coming on the show.
Thank you for having me.
Okay, you look very pretty. You look very nice and dressed. I'm glad you dressed up for my show.
Yes, I did.
Well, you dress up every day.
I do dress pretty formally at work.
That's good. Hey, where are you from?
I'm from York County for most of my life.
Mm-hmm.
I have moved around a bit, met my husband down in South Carolina, but York County is home.
Yeah. Now, tell me a little bit about yourself. I mean, like your background and so we get to know who you are. We'll talk a little bit more about certified nurse practitioners, which I think is very interesting, as healthcare is going these days.
Yes.
I think it's reconfirming the fact that we do have good healthcare, and we'll get into that a little bit later. But tell me about what your background is.
Well, I graduated from Westchester University in 1984, so it's a few years ago, as a registered nurse, and worked as a registered nurse in different areas for a number of years. The last area that I worked in was HIV care. I was a nurse care manager for an HIV program in York, Pennsylvania, and I enjoyed it very much. I spent some time over in Africa in 3 different countries there, and while I was there, I came home and I kind of thought, wow, if I can do this, I can go back to school and become a nurse practitioner. So 5 years ago, I went back to Millersville University, graduated from there 5 years ago as a nurse practitioner. I've been working in family medicine in York, doing both family medicine and HIV care in the same clinic that I was a nurse manager at. So
Tell me about Africa. This is interesting.
it is very interesting.
Well, first of all, how did you get to Africa? And why did you go to Africa?
Good question. So I was, I guess, recruited by the Equal Healthcare Access. It's an organization that provides HIV care to individuals that are in developing nations. And the nation that I went to was Lesotho, which is in southern Africa. Actually, it's enclave, what they call an enclave nation. It's actually surrounded by South Africa, but it's a small country all to itself. At that time, the small village that I worked in, there was predicted about 2/3 of the adults were infected with HIV. And the Clinton Foundation was actually procuring the medications for HIV care there. And I was training clinicians in how to use the medications and side effects and that sort of thing.
How did that progress?
It did really well. The rollout of the program there in Lesotho was very good. They were able to get a good number of people on treatment. And once people are on treatment, they do well. It's just getting access in developing nations has been a challenge.
How has the progress been on HIV medications, et cetera? You know, how is that?
In the United States, it's fabulous. We have great medications that work very effectively with minimal side effects. Some individuals are even able to take 1 pill a day to control their HIV disease. Many people live full lives.
So you worked there for 5 years in Africa?
No, I worked in Lesotho for 6 weeks. I worked in York for 5 years as a nurse practitioner.
So you were there for 6 weeks?
6 weeks there, and then I was also in South Africa for 2 weeks, in Ghana just a year ago, now today it would be, in Ghana for 2 weeks working in HIV care.
You have to have a passion for this.
I do.
Yeah, my wife's a registered nurse, so I know the compassion people have, especially nurses. I applaud them. Even the aides and the people who are LPNs, they just do a great job. To have a passion for what you do, it comes across, doesn't it?
Yes, it's something you cannot manufacture. It's something that comes from within. And actually, my interest in HIV care goes back to I was in seminary years ago, and that's how I met my husband, actually.
Is he a minister?
He's a pastor, and that's what brought us here to this area. He's a United Methodist pastor, and the bishop moved us to Mountaintop, Pennsylvania.
Oh, well, good luck.
Thank you. We really like it there. So he's at Christ United Methodist Church there in Mountaintop, and
that's nice.
And so that's why I left my job and have moved to this area.
So you came here, okay, with your husband. So what attracted you then to Lehigh Valley Hospital?
Well, I'll tell you, I really wanted to get into family practice. When I came to the area, I was looking for a family practice position and didn't find anything right away. I worked part-time at Scranton University teaching, and I really enjoyed that. And I was working part-time with urgent care. But I really wanted to get my roots back into family medicine because that was my passion. So one of my students at the university said, "Hey, have you ever heard of Lehigh Valley Health Network?" And I said, "No, I never heard of them because I'm new to the area." And she said, "Well, why don't you check them out?" So I called, and as soon as I called, there was a person on the phone, on the other end of the phone, that was responding to my questions and my desire and my passion and asking me questions back, trying to find out more about my interests. It was the personal touch that really got me interested in Lehigh Valley Health Network. They sought to make a match for you as a clinician to the appropriate practice. And it was a unique experience. I was impressed with their staff, the people that I met in the interview, through the interview process, and I was impressed with their vision. It's a company that has a lot of vision and has a future in mind. And they've learned from their past, and they were free to share that, which a lot of organizations may not be as open in that regards. Also, the fact that it's a not-for-profit organization is very attractive to me because I like to be able to serve all people. Indigent healthcare is part of my desire as well, serving people that are underserved or can't get access to good health services.
So what were some of the things that you wanted to do and look for, when you call? Because it's a two-way street.
Exactly.
You have questions and they have questions, and then you have a marriage here. So what were some of the things that you were concerned about in healthcare that Lehigh Valley Hospital was able to satisfy?
That's a great question. So there was one of the things, I think, first of all, was the fact that they got my interest. They got the interest that I had in family medicine. They knew that I wanted to provide care for the entire family. From when I worked in York, I cared for patients from birth to death, I'd say, from infants, newborns to elderly patients. And I liked that mix of patients and the ability to provide care for families. And they had a real good understanding of that and wanted to be able to provide more of that service in the area where I'm working. They also were looking at what they wanted to do as far as growing their family practices, that they wanted to be able to provide care to where the people were and provide care for everyone, whether they have medical assistance, Medicare, or health care that's outside of that, like a Blue Cross Blue Shield, but to be able to provide quality health care to all individuals. They also had a focus of what the needs were, and I was really impressed with their focus of what the needs were in the community of Hazleton and how Hazleton has grown and changed. One of the individuals that I interviewed with was Dr. Valent. And
Great guy.
Oh,
Yeah, he's a great guy.
Amazing.
Yeah.
And just his passion
for
providing great services to all people.
It's nonstop with him. It's nonstop with him.
And it was clear.
Yeah.
And then I also met with the president of the hospital.
And who may that be? John Fletcher?
Yes.
Yeah. Another great guy.
Yes. He was so nice.
Yeah.
And it was really interesting during the interview. He was more interested about me.
That's John, yep.
Than about
Yep.
all this work thing.
Yeah.
He said, I'm not a medical person. I want to know about you.
Yes.
I want to know what brought you here. Why are you pursuing work in our area and with our company in particular? So it was the whole feel and the desire to provide quality services to the community.
It's interesting because the reason I ask you that is that you did not know about Lehigh Valley Hospital,
No.
okay? So now you're a newcomer saying, let me find out about this hospital. It's going to work for me and will it meet my goals, okay? And your standards are high. And you found out with Lehigh Valley Hospital that they had the same standards, correct?
Exactly. And that was more clear with them than other organizations that I had looked at. Their desire to serve where they were and to reach all people, it was clear in their mission.
As John Fletcher said on my show, he said, in this area, and we have great health care, okay, in surrounding areas, and everybody has something to offer, okay, and that's the good part, okay. So it's a matter of the fact that now the greater Hazleton area is very fortunate to have great doctors in all areas, okay. So when you're looking at, so you decided after they were able to satisfy your needs and they were, you satisfied their needs, etc. You decided to come on board then, right?
Yes. Another thing that impressed me was just what you were saying there, that they have the wellness center that provides a lot of different opportunities for individuals in specialty healthcare, because for a lot of people it's difficult to go outside of the area,
sure,
in terms of transport or whatever, but to have orthopedics providers and pain specialists and cardiac specialists all in one roof, if you will, is an amazing thing.
So you come on board, okay, and I want to, after break, I want to talk about what is a certified nurse practitioner, okay, versus a physician's assistant, okay. Folks, I'm talking to Robin Bohanan, as she's a newcomer on board, not new to certainly her profession, but newcomer to the greater Hazleton area, certified nurse practitioner. Her number is 570-788, very difficult number, 5000. That's 788-5000. We'll be back right after this message. Welcome back to the Sam Lesante Show, folks. We learned a lot on the Sam Lesante Show about healthcare, and today we're continuing on our journey to learn a lot more of what's going on in healthcare in northeastern Pennsylvania, particularly in the greater Hazleton area. My email is sam@ssptv.com, and of course our website, ssptv.com. Every one of our shows are there, folks. You can watch all of the shows we produce, including all these health shows. My guest today, Robin Bohanan. She is a certified nurse practitioner, and it's so nice to have her on board. And I forgot to ask you two things. Number one, you are married to a pastor, right?
Yes, 24 years.
24. How about 40 with me?
That's great.
40.
Isn't it wonderful?
And knowing my wife 10 years, so I should be, we just celebrated our 40th anniversary. How she put up with me for those years, I have no idea. But how many children do you have?
We have two sons.
Yeah.
They're both in college. One here at the Penn State Hazleton campus, and one at Penn State University at State College.
Terrific. And the person you spoke to on the phone was Melanie, right?
Yes.
I have to give our Melanie because she does a great job.
Melanie
Melanie used to work here?
No, I didn't know that.
She was the big
She was the recruiter that I worked with, and she was amazing.
Yeah.
She, anytime I had questions, I could easily come to her, and she would guide me in the right direction if she didn't have the answer.
Wow,
and
that's good. She, we knew her as Kalinowski. What's your married name now? Brian. Okay, well, it's a little difference from Brian to Kalinowski. What is, before I ask you the difference, but what is a certified nurse practitioner?
Certified registered nurse practitioner in the state of Pennsylvania has a bachelor's degree in nursing, has gone to school for 4 years to achieve that, and then has worked in the field of nursing as an RN for a number of years before they have gone back to school to complete a master's degree in as a nurse practitioner. And that program is between 2 to 3 years in length, depending on the university that you attend. A nurse practitioner has the ability to see patients in various settings. I personally, my area of expertise is in family medicine. So I work as a family practitioner with Dr. Deborah Mistel in Drums, Pennsylvania. And we provide care for individuals in that surrounding area. But nurse practitioners can go into subspecialties, whether that be cardiology. I understand that there's a new nurse practitioner at the hospital who's working as a hospitalist, a specialist there in the hospital, along with Dr. Valent. So there's different areas that NPs work in. NPs are certified by the state and can write prescriptions. They can perform treatments and basic procedures.
What's the difference then between, as healthcare is changing, everyone, because, people are used to going to a doctor, okay?
Right.
And of course, as healthcare changes, there's different things. There's the nurse practitioners, okay, there's the physician assistants, and I think sometimes people are leery as to, well, I like you, Robin, but I really want to see the doctor, okay?
Right.
And how do you address some of those things? Like, what's the difference between you as a nurse practitioner, the physician assistant, and the doctor?
That's an excellent question, and there are differences. Sometimes those lines are kind of blurred in family medicine, but a physician obviously has increased time that they spend in education and in practice, in residency and training, and a lot more educational experience over time than a nurse practitioner or a PA. PA is physician assistant. Yeah. Physician assistants and nurse practitioners both generally have master's level education. They work very closely in terms of their licensing ability. There's a lot of overlap there. The physician's assistants are trained more in a medical model, and nurse practitioners are trained more in a nursing model. So there's a lot more emphasis on whole care, family, meeting the needs of individuals that goes beyond just the physical, but the emotional, the entire individual. But there's a lot of similarities in an office. Like if you were coming to me with strep throat, you might not see any difference between seeing me and...
That's the point. The point is, can I feel comfortable? See, especially seniors, all right? Again, there's a mindset here that you understand, Robin. You go to big cities, it's common. There's no, but in small areas like we have here, and they're all beautiful people, they're concerned. Yes. I like you, Robin, but I want to see the doctor. Okay, so can I feel comfortable? All right. I know the answer, but I want to ask this for our viewers. Can I feel comfortable in seeing Robin Bohanan, a certified nurse practitioner, when I go to your office at Dr. Mistos?
Absolutely. And a nurse practitioner always has a link to a physician if they have any questions.
That's the point. So the point is that once you see that particular person, whether it's a sore throat or whatever, if you feel at that time that you cannot go further, then that's when you go to the PA or go to the doctor.
Well, not a physician assistant, it would be a physician.
Okay.
So the physician's assistant works...
together, okay.
Yeah.
So you would go to the physician. You would go to if you felt there was something. So, and that comes with experience, I guess, doesn't it?
Right, and the thing that nurse practitioners, now this is my bias, have going for them is they were nurses first. They were registered nurses that worked in many times in acute care and long-term care situations, and they know people.
Excellent. That's exactly. My wife says the same thing. That's excellent. Okay, because you had that experience, and there's no reason for anyone to feel uncomfortable. Am I correct?
That's correct. And believe me, the state of Pennsylvania would not license us to be able to write prescriptions for chronic medical problems or pain or management or even acute problems such as the sore throat if they did not feel confident that nurse practitioners were trained well and able to do that.
I find that very interesting because as healthcare changes, and we've had a number of changes, and I don't want to become political. What we have is what we have, okay?
Right.
And as things develop, they'll develop, okay? And the interesting things about all the healthcare organizations that we have in the state of Pennsylvania, to me, they've adapted to what the needs are, okay? In some states, it's not doing that well, okay? Whatever, let's talk about the greater Hazleton area. As you look at healthcare today, How do you view it? You know, you're married, you have children, you know, you're just like everybody else, okay, when it comes to healthcare. How do you view the healthcare situation today?
So I think there's strengths and weaknesses. I think there's things that we need to have on our radar in terms of healthcare. Preventative medicine was a big discussion years ago. People would talk about preventive medicine, make sure you get your immunizations, your pap tests, your screenings, your colonoscopy. And it kind of got blurred in all this debate of healthcare and access. And I think it needs to come to the forefront again. You know, what's that saying? An ounce of prevention is worth a ton
of cure, whatever.
A ton of cure, yes.
I may be wrong, but I know what you're saying.
Yes, and it is true. You know, we're seeing more individuals not coming for preventative medicine. You know, more families making decisions maybe not to immunize their children, which is tragic.
Why is that? Is it a cost factor now?
Part of it is information that is false. People are afraid that the immunizations aren't safe, and that if their son or daughter is immunized, they may get some other disease or
now the odds
disability.
Are very small.
There actually have been, autism is the thing that comes to mind, that you often hear in discussions. But that has been disproven. But as long as people still have that myth out there, they will not, they will refuse. And in the end, we are creating more powerful disease processes. Same goes with prescription medication. When I see patients that have an upper respiratory infection, most of the time, if it's within the past 72 hours, most of the time that's a viral situation, which does not require antibiotics or prescription medications. However, individuals have gotten into patterns where they have demanded these antibiotics through the years and received them, and because of that, we have created superbugs, if you will, resistant microorganisms. And some of our antibiotics that were very good years ago, we're not able to use as frequently now because the bacteria have become resistant. So there are a lot of ways that healthcare is trying to reclaim some of the mistakes of the past.
So what you're saying is prevention is always the key.
It is important.
If a person, there's different seasons, and we try to, every season, we try to bring medical people on to talk about what, you know, we're coming into the flu season, I would assume. What would be your suggestions now?
Flu shots.
Yeah. I never get a flu shot.
Yes.
Last year, the girl who was on, someone was on trying to tell me to get a flu shot, but see, I'm allergic to maybe eggs or whatever. So they have, do they have allergic things?
Yes, they do. And you need to let your provider know that. And but there are different immunizations.
So even though I haven't had, I'm getting free medical, I love these shows, I get free medical advice.
Yeah.
So even though I haven't been taking a flu shot for years, you
know. I would advise you to talk to your healthcare provider and see what they recommend. Look, people, especially as individuals age or individuals who are young of age, when they get the flu, they can end up with pneumonia, in the hospital, very seriously ill, and it can be a very difficult situation, sometimes requiring ventilators and...
now you're starting to scare me. You
yes.
understand? I don't want to be scared here.
Yeah,
okay.
Influenza is not something to take lightly. And the immunization that we have is very reliable. It's low chance. I have patients say to me, the only time I received a flu shot, as soon as I got it, I got the flu.
Yeah.
And so I won't take another flu shot. But it takes about 2 weeks to build up antibodies.
So they really didn't get the flu, or did they get the flu?
They did not.
They got a reaction, or what?
Likely they had been exposed to the flu and got flu-like symptoms after they got the immunization. Didn't have anything to do with the immunization. as I said, it takes 2 weeks to build up antibodies to with the immunization. So in those 2 weeks period of time, they may have been exposed and
So when is it best to get the flu shot?
Right now.
Right now.
Yeah,
Before
yeah.
the
And the flu vaccine is available in a lot of communities at this time.
But here again, I may be allergic to certain types of eggs or whatever.
And that's and honestly, I will be honest with you, I'm not sure. I know the live vaccine is different than the one that we give in the muscle. It's a nasal spray. I'm not sure about egg allergies with that one. Okay. I'd have to look into that.
All right. See, again, folks, I'm talking to Robin Bohanan. She is certified nurse practitioner. As you can see, folks, well-trained, well-qualified. You should feel comfortable, no problem. Her number is 570-788-5000. I love these shows. I get all this free advice, I wish you well. You're a beautiful person, and tell your husband I wish him the best in Mountaintop and the best, of course, to your children. And I'm sure you're going to service our area very well.
I'm very happy to be in the area, and working with Dr. Mistel, it's a great honor.
And please send my best to Dr. Mistel and her husband. They're two beautiful people.
They are.
Folks, remember, you can watch any of our shows on ssptv.com. My email is sam@ssptv.com. We'll see you next time.